ago, I knew that the bicentennial was approaching in 2004, but I didn't know very much about Haiti. And a dear friend of mine said, oh, you have to read The Uses of Haiti. And I'm very pleased she made that recommendation. I read The Uses of Haiti by Paul Farmer, who has worked tirelessly in the field of health and human rights. He has worked tirelessly in the field of health and human rights in Haiti for the past 25 years and many other parts of the world. Reading that book changed my life. I know many of you are here today because you're reading Mountains Beyond Mountains for school. Go! Yes, great teachers. And now having teachers require you to read The Uses of Haiti. That's a good follow-up. So, and get to know Haitians. The Haitian friends that I've made are wonderful, inspiring people. So without further ado, Paul, thank you for changing my life.
Wow, it's great to be back at St. Joseph the Worker. Now, if only I had gone to a Catholic church like this when I was a kid, I wouldn't have had that fallow period for about 15 to 25. Or if I'd had Father Jerry in the pulpit, that would have been a little different. But now we have Father Jerry in the pulpit now. That's like Father Jerry in the house, you know? It is a real privilege to be back here. And I'd like to thank you, Mark, for your kind words. Now I know who bought the other copy of Uses of Haiti besides my mother. And my brother was here too. I want to start, I could go through the laundry list of thanks, and I should. I especially want to thank my friends in the Haiti Action Committee, and here, of course, and the many solidarity groups based here in the Bay Area. As Brian said, your work and your engagement and your resistance to disinformation has made a great difference to all of us working in Haiti or working on Haiti issues. And I hope that you'll follow Brian's recommendation and remain engaged and get even more engaged, because you saw the courageous people in that film. By the way, it's amazing to me that you guys have been able to put that together in such a short amount of time. And I want to congratulate you for doing that. That's not easy work, and it's not safe work, it's dangerous work. It's obviously much more dangerous for the Haitians than it is for Americans, but I just want to thank you very much. And it's great to see to see her out of prison, and all those other ladies who are obviously terrorists, as you can tell by so thank you all for what you're doing, and it inspires us, those of us who are working in Haiti, and again, like people like Brian and people like Father Jerry, two heroes of mine certainly, and another reason it's wonderful to be back here. Actually, I think it's the first time that Brian has been to this great community. I'm going to focus my remarks on public health and medicine, because Brian and Jerry are here. But as you'll see, it's really not a different subject from the one that was addressed by Maureen and by the delegation in the film that you saw. It's the same topic, and I'm sure it'll be the same topic that Jerry talks about. However, you know, when you heard the Maria translated for you the words of some of the women singing there, Haiti sick needs a doctor. Unfortunately, the ability of those of us in medicine and public health to make a very substantial difference is limited. It's not absent. It's not true. We'll hear this sometimes, and I've certainly thought about it at times. You know, the situation is so dire there that we cannot make an effective intervention. That's not true, actually, but I'll discuss a little bit about the limitations, and you should know about them. First of all, because there are many supporters of our work who are here tonight. I hope you'll continue supporting our work, even though I'm going to be very candid about the limitations of our effectiveness. You know, of course, that it's very difficult to practice medicine at all in settings of violence. Now, medicine as practiced traditionally, what most of us think of as medicine, waiting in a clinic or a hospital, It's still possible to do it. You can even, if you have good blood banking and surgeon, you can respond to the violence that we've seen in central Haiti, and that there's certainly a great deal more of it in Port-au-Prince. And we will do that, and we will continue to do that. That's our commitment to the Haitian people. For those of you who don't know about our work, we work in central Haiti. So if somebody says anything about Haiti, north, south, who was that? It was you, Maureen, another terrorist, Maureen. Can't you tell by looking at her? You said something about north, south, east, west, don't forget central. And then I said that to Brian, he said, but you got that covered. And we do. I think we've done a good job. And I'm just going to say a word about our work, which is in many ways equivalent to the IJDH. We've been at this a long time. And Brian said his organization, but it's all of our organizations, IJDH, because unlike our work, which has limits, geographic limits, in Haiti, we work in many other places as well, IJDH is, of course, working on behalf of justice for all Haitians. We, however, are in the middle of the country. Many of you have been to visit our facilities. Some of you think that we're working in one place, Conj, but actually, Partners in Health is now running 8 different facilities, most of all of the major public health institutions in Haiti. I'd like to tell you about the irony and be candid about some of the mistakes we've made over the last quarter of a century, because we've been working there for that long. In the mid-80s, we opened up a clinic, which became a very large clinic, and then a hospital, and then a very large referral medical center. And we're very proud of it. It has 2 operating rooms, over 100 beds, a women's health center, large women's health center, and it's a major referral facility for infectious disease. And some of you have been kind enough to follow our work on AIDS, for example, and tuberculosis and other epidemic diseases. So we're proud of that work, but after about 20 years doing this, or maybe 15, we just started asking, well, what have we done wrong? What have we failed to do? And we decided that one of our failures had been to invest in the public health infrastructure. Now, in 1983, when I first started working in central Haiti, we had good reason for not wanting to work with public health infrastructure, and that's because it was the government, and the government, as you heard from Brian, was at the time a family dictatorship, and we didn't really want to work with a family dictatorship. And this went on, so we grew really quite independently, and we're never ashamed of that. When the first democratic elections occurred in 1990, we initiated a series, right after that, really, initiated a series of projects with the government of Haiti, the elected government of Haiti, especially working on HIV prevention and eventually things like safe blood banking, which is, unfortunately, one of the only places really able to transfuse blood regularly in central Haiti. So we started a number of projects, and then, as you know, 7 months later, there was another coup. And I'm starting to think, Maureen, you said you've been down in Haiti where there's coups. I'm wondering if there's not some connection between our trips to Haiti and there's coups. And we can do the math on that later. In any case, you have to have a sense of humor now and again if you're working in Haiti. I just got back from Haiti and last weekend, and maybe some of you want to talk about just what's going on there right now. But I'm going to go back to medicine and public health. So in the mid-90s, by the mid-90s, we built a hospital. It's a hospital for poor people. And again, many of you have been there. We worked hard to make sure there are not barriers to access to care because we believe in basic rights. Now, as you know, there's this big debate, and I'm looking forward to going to USF for the first time on Monday, learning more about their program on economic social rights, because the notion of rights that many of us have, that is, civil and political rights, the right to vote, are often disparaged, I find, by people living in poverty, not as unimportant, but as insufficient. And so a lot of our focus, Partners in Health, and also more recently, IJDH and other groups, has been on basic rights, the right to health care, the right to education, the right to clean water. I mean, we'd love to see really radical rights like the right to employment. Now, maybe it's because I'm an American, it took me a little bit too long to understand the importance of social and economic rights. This is a country, my country has been quite hostile to social and economic rights. I didn't even know that this debate existed until maybe 10 years ago, when I started writing more about rights and learning that there were these distinctions made between civil and political rights on the one hand and social and economic rights on the other. So what we did in our medical work was to ask, as I said somewhat tardily, what have we been doing wrong? And by the time of the the elections of 2001, which unfortunately occurred in Washington and Haiti at the same time, that is, the United States and Haiti at the same time, although some have argued that only one of the two presidents that I'm thinking of was elected democratically. That was the Haiti Action Committee poster, that picture of the two presidents in question, and it said only one of these men was elected democratically. But what we did then, actually really a little bit before then, but gearing up, that, by the way, 2001 was the first in 200 years, practically, the first time a democratically elected president handed over. I guess that was Préval, Aristide Préval in the 90s, but it was the second time that this had occurred in Haiti. That is, there wasn't a coup, but there was a handoff at the right time. So we decided, Partners in Health, that we were going to expand radically, but only in the public sector. So, in other words, we had a hospital for poor people. We even trumpeted, and I think Sister Maureen and Father Jerry should give me good benedictions for this, the whole notion of preferential option for the poor. We've done a decent job, I think, but we decided that NGOs like ours cannot offer rights to poor people, or anybody for that matter. We're not elected. We can do a good job. We can build institutions for poor people, but only governments offer rights to their citizens. Now this, again, I'm embarrassed to tell you, took me about 15 years to figure out. And then what was our action plan? Our action plan was to go into the rundown public health sector across central Haiti. And some of you know Haiti, so I'll mention. We went to Las Cabas, Veladeo, Tomon, Hench, Secalasus, and Bucancare, and rebuilt or built from scratch the public health infrastructure, working with the Ministry of Health, and bringing back nurses and doctors who, of course, were unable to do the work because they didn't have the tools they needed. They didn't have medicines, or they had to sell medicines. In other words, medicines were commodities, not rights, just as medicine is in this country. And we fought hard against that for 5 years, and continued doing that even through the coup. So although it's very difficult to do public health in the middle of violence and unrest, and we shouldn't have to do this. We shouldn't have to work under these circumstances. We had 4 ambulances hijacked by the paramilitary. We had a number of people kidnapped, good people, who some of them you know. We've had a lot of trouble, but we have soldiered on. Actually, yesterday, because it's important to mention the ecological crisis in Haiti too, which will undermine the ability of the peasant farmers to feed themselves and therefore will make them sick because they won't have enough to eat. Yesterday we had an ambulance swept away, a truck rather, swept away in a flash flood along with the medicines that were in it. Fortunately, the people inside were able to get out before this big wall of water came rushing through this area where we were. So that's what we've been doing, and those of you who support our work have been supporting offer some basic healthcare services as a right through the public sector. And that's what we've been doing too in Rwanda. I spent much of the summer in Rwanda, and our Haitian co-workers have also been in Rwanda helping set up the same system in Rwanda. And I think, although I'm the one here representing the Haiti team, by accident, it's really the Haitians on the Haiti team, which is 99% of our team, who represent themselves in this work in Rwanda and Lesotho and other places where it's made. One last comment, and I wish there was more, because Father Jerry is here, I just want to mention the situation in Haiti's prisons is very dire. We are trying to work with the prisons in central Haiti. It's not easy to do. There are actually some reformers, Brian would know more about this. Some of the people in the prison system who are not bad, in my my opinion. In fact, when Father Jerry was sick, I have to say, I was in Rwanda. He knows this story. I was in Rwanda, and I was in this capital city, Kigali, for a meeting, and was staying in a hotel, and I was watching CNN, the War Channel. And on the bottom of those little annoying scrolls, what are they called? Scrolls or something. And it's, it gives me the stagnance. I feel like I'm going to have a seizure when I keep watching this. But anyway, I was watching it in the middle of Central Africa, and it says, Father Gerard John Hughes named prisoner of conscience by Amnesty International. And since Jerry has been a friend of mine for a very long time, actually we met in Miami in the 80s when he founded the Haitian Refugee Center, I said, thank God, it's about time. Because I was thinking, where are the human rights communities? I've already confessed my dissatisfaction with the human rights community for a focus on certain types of right violation, ignoring the violation of the rights of the poor. This is a major problem. Amnesty, by the way, has just been taken over by someone who really believes very strongly in social and economic rights. So there's some new leadership there that I think is going to help. But I said, thank God, because this is crazy that people like me, sitting in Rwanda, have to worry about what's going to happen to Father Jerry, who's sick. I'm getting emails actually from Brian, who probably started it, saying, Father Jerry's sick. And I thought, well, he's an Amnesty International prisoner of conscience. The international community, the Red Cross or somebody ought to be going in there and finding out what's wrong. And I made when nothing happened that was definitive, and many people, people like me, Americans and friends of Jerry and others, like Brian, was working relentlessly along with many others, including Brian's co-worker Mario, taking courageous stance on thinking about getting Father Jerry and other political prisoners out. I started calling the administration of the prison. And I usually get hung up on and I would try schmoozing them. Once in a while someone would say, oh, Dr. Paul, you work out in Central Haiti. My mother loves you. And that stuff helps. So I finally got through to the one of the high-ranking people in the prison system, and he said, I was saying, I'm calling because I'm worried about Father Jean Juste. He's sick and he's not getting proper medical care. And he said, that's okay, but what about the other prisoners? So that just says to me, just as in the public health system, we can't afford to dismiss the Ministry of Justice and the Ministry of Health, although very feeble. The Ministry of Health is probably full of more good people than the Ministry of Justice. It hasn't been stacked. If you don't stack I hope you don't stack the Ministry of Health with anti-democratic doctors, although I know there must be some. But there are people there who would like to see things better. In any case, it didn't work out for Father Jerry, so I had to go in and bother him myself with lots of sharp things, needles. He never complained, by the way. But that's his story. I just want to say that there are lots of people who are not political prisoners or prisoners of conscience who are in jail and receiving nothing in the way of medical services. So something to think about as well when we talk about medical care in Haiti. It is possible to fight back, and Ryan, I think, has made a better list than I will. I'll close here. And we fight back through pragmatic solidarity. That is, what you do, solidarity, we're also using your support to do things like think about food security, not just think about it, actually help people have food security, enough to eat. This jargon of food security bugs me. And obviously medical care, a very massive expansion. I think this year we're going to see in the field or in our clinics or hospitals over 2 billion patients. That is 2 million patient exchanges. So we're the largest provider of healthcare in Haiti now, along with the Ministry of Health in that area. And that's one way to fight back, to make sure that people are not so sick and coughing their lungs up so they can't fight back. And I've never been ashamed of that role, and I don't think doctors and nurses and community health workers should be, but it's just not enough. And we'll continue this fight, and we'll continue our efforts to serve large numbers of people living in poverty. But it's really going to be people in this sanctuary who are going to make a difference, because the problem, as Brian said, in terms of making the United States safe for democracy in Haiti, the problem is more in Washington than anywhere else. Bay Area, for your support for social justice and for social and economic rights like the ones we try to provide. And we won't stop, and it's extremely uplifting for me to come back here and see the church full again and know that you're on the case too. Thank you very much. I look forward to this.
Brian said, we in the Haiti Action Committee, and really all of us, owe a great debt of gratitude to some of the brave journalists and commentators who have really kept the voice of the Haitian people alive during tough times since the last coup. And so I'm just going to read them off, and I'd like us, if any of you are in the house, please stand up. We'd like to recognize them. Dennis Bernstein of Flashpoints. Kevin Pina of the Haiti Information Project. Wanda Xavier and all of the staff at the San Francisco Bayview. Walter Turner of Africa Today.